everyone watching us live from Bethlehem, from PNN studios. The world is facing a global pandemic with over 1.8 million cases and 100,000 deaths. Today, the Palestinian Authority announced a few new cases, raising the number to 288 cases, 58 of whom have recovered and sadly 2 have passed away. We are talking about full closure of Palestinian cities, entrances and neighborhoods, with the exception of a few essential facilities and the freedom of movement for security and police forces, in addition to the medical staff and journalists. In related news, the Palestinian Ministry of Foreign Affairs yesterday announced that 614 Palestinians from all over the world have the virus, 25 of whom had unfortunately passed away. To talk more about this, we are joined by Palestinian Ambassador to the UK, Dr. Husam Zomlot. Thank you for joining us, and please put us in the picture of the general situation in the UK, the cases, the health conditions, the precautionary measures that the government is taking to curb the spread of the virus.
Hello, Noor, and thank you for having me, and allow me to use this opportunity also to wish our people in Palestine at home well. We wish them safety, and we commend this cooperation between the government and the people, the level of trust and awareness, and this exemplary approach of containing and mitigating this pandemic and this virus. So we salute all of our people, all of our security forces, of course, our medical teams and doctors all over the place. And it has been a source of pride for all of us that we have been, despite the bigger virus and the longer-term virus, which is occupation, despite the military occupation, despite the Israeli constraints, that Palestine has really been one of the countries in the forefront of the fight and the most capable of actually containing it. As for the UK, regrettably today the UK has passed the 10,000 deaths because of the COVID-19, the coronavirus, as was announced by the health minister here only an hour ago. The level of deaths every day in the last 3-4 days have been almost 1,000. Today it was a bit slower, 700 and something thousand, 700 deaths. This is a pandemic, and it is unfortunately affecting everybody all over. There is a lot of pressure here on the NHS, that is the National Health Service, and there are very clear instructions by the UK government, primarily for social distancing and isolation. And the message from day one has been clear. The more the people are capable to stay home, the better the dealing with the situation. Over the last couple of weeks, there has been a lockdown, and this has really helped containing and decreasing the level of infection. So hopefully we are peaking at this point in time here, and hopefully because of these very serious measures that have been taken by the government and the cooperation by the British people, things will be relaxed. In a way, the containment would have succeeded relatively, and the infection rates are being reduced. A happy news here in the UK was the release today, this morning, of the British Prime Minister, the Right Honourable Boris Johnson, who was admitted to hospital a week ago and then taken to the intensive care because he had difficulties having been tested earlier positive with COVID-19. And he released a video this afternoon thanking the NHS, the nurses and the doctors for saving his life. He said that he owes the NHS his life. So it tells you how severe the situation was with the Prime Minister and how much medical help and medical intervention is really helping people. And that's why the whole idea here, and I believe almost everywhere else, is to try and release the pressure on the medical services and making sure that at least every patient gets the full medical attention they deserve, regardless of the outcome. But people deserve the dignity of being treated. So unfortunately, there is bad news, and also there is good news. The bad news is that the UK is one of the high countries in terms of the infection rate and the death rate. the good news is that hopefully this infection rate is going to slow down after the lockdown and the serious measures that has been taken here. Our community here, the Palestinian community, there has been several individuals and families who were infected by the COVID-19, and they approached us. They called the embassy, and we have been calling them, following with them anything they need. The numbers are in the tens. Thank God they have been recovering, all of them, at home. We only recorded 2 cases that among our community that has been hospitalized. So far our community is doing well. Our doctors are in the forefront of the fight against the virus, and we are very proud of the sense of community among the Palestinian community and the sense of togetherness and the help they are extending to each other.
Yes, thank you very much. And of course, in this condition, we wish wellness and health to everyone. So we know that the Palestinian community in the UK is a really big community. We're talking about 20,000 people in the UK. And there are families, immigrants, refugees, and there are also many Palestinian students in UK universities. And many of those people will have found themselves homeless in this condition, especially with the lockdown and the stop of many facilities. So how are you trying to stay in contact with these people? How are you ensuring that they are safe and well in this condition?
Well, from day one, Noor, since the anticipation for this crisis, because we knew it was coming by late February, early March, we formed an emergency committee consisting of members of the Palestinian embassy here, the mission, and of representatives of our community everywhere in the UK, in London, in Manchester, in Wales, in Scotland, everywhere. But also the committee included institutions, Palestinian community institutions, and charities and what have you, and doctors. We also have very strong doctor community here, physicians, and that committee has been in charge of following the crisis and mitigating it and helping people. And short after we announced emergency numbers that was available for our community, expecting that some cases would appear where people have, lost their income and they have nowhere to go. Some students may want to go back home unable and stranded here. Some visitors who came only for a few weeks to the UK and found themselves in the middle of this big crisis. So we were aware of all that, and we have approached our business community, the businessmen here and women, seeking that they operate a special emergency fund to actually help ease the pressure on the extreme cases among our community. And our business community was very quick in its response, and they have been very generous, and they immediately made available limited resources, but important resources that have allowed us over the last couple of weeks to actually resolve some of the issues you mentioned, some of the examples you mentioned. Anybody who may have found himself or herself totally unable to support the living expenses.
Mm-hmm. And on an official level, were there any steps by the UK government to try to protect the foreign communities in the country?
The UK government, and I believe this goes for all other governments, do not discriminate or between local and foreign when it comes to issues of public health. So long as you are in the UK at the time of this crisis, you must be treated as a UK resident equally like any other UK citizen. And therefore all the legislations, all the procedures, all the guidance apply on everybody, and all the treatment and all the services also should be applied on everybody here. So if you get sick, if you are a foreign national, you will be treated like a British national, exactly. However, this is a matter for us as foreign missions and embassies to make sure that our communities are provided for, to follow case by case, to always be ready to deal with emergencies. Somebody who may have lost their passport, we are now have provided a much easier way to actually provide people with their passports. We received an instruction from the foreign minister by the Palestinian cabinet that we can now, in the missions abroad, extend passports for 1 year without any charge, free of charge. So there are issues that we can do as embassies and missions to ease the situation and make it easier for our people in many regards. Also, the issue of return back home once the situation starts to open up. Once flights are operating, this is also a matter that we are following with the British authorities and with the respective countries that our people may have to fly to go back home, like Jordan, for instance. So we're in touch with the Jordanian ambassador here regularly to make sure that once the Amman airport opens and flights operate, that our students here and those who want to go back home are able to do so.
And speaking of the services that are done by the embassies abroad, of course, 2 days ago you met with the Prime Minister, Dr. Mohammed Shteye, to discuss such matters, and I guess the extension of passports was one decision out of the meeting. So were there any other decisions that were taken in that meeting?
Yes, from day one we have received instructions by the foreign ministry, our foreign minister, our government, our leadership, our president. It was very clear from all these sides that we must extend every help possible. That this is a time that we need to focus primarily on the safety and the health of our communities. And since the beginning of this crisis, we have been given every single ability to actually deal with any case, be it legal, be it financial, be it humanitarian, every case. So I must say that from day one, the instructions have been very clear. Focus on this, make sure that our people are safe, make sure that our embassies and staff and colleagues are safe. Their lives come before any other consideration. And, whatever we have asked for has been answered with a yes, positively, by headquarters, by the government back home. So I must say, this experience have shown our people at home and have shown our people outside in our communities and, through our embassies and ambassadors, that we truly have a leadership and we have institutions, national institutions, that care about us and care about the people. And the decision-making process over the last weeks and months since the beginning of March by our government, by the Prime Minister, and of course at the instructions of our President, His Excellency President Mahmoud Abbas, and how early on we started this whole thing. We were among the first in the region to actually apply lockdown and to be very cautious and very firm in the measures, and people are following also how much the various Palestinian national institutions like the Ministry of Health, like the security apparatuses, the security institutions, people are seeing, like the governance everywhere, people are watching and following, and there is such trust that is being built that is very cherished and very important for all of us. So just in a nutshell, what has been happening is awful in terms of the human loss, in terms of this huge pressure on people's livelihood, people's ability to move, to meet each other. This is a nightmare in every sense of the word. The loss of lives is immense everywhere. And what is happening in Palestine is not far from this. However, there is that good side of it. The good side of it is people coming together, the sense of solidarity, sense of togetherness, sense of unity. Really, in the last so many weeks, I have been receiving calls from our community in the UK here, in Britain, from all over, just telling me, Ambassador, we are here to help. Just tell us, let us know what do you need, whatever our people need. So this sense of being one family, really this COVID-19 has solidified our resolute and our togetherness and our ability to actually help each other and focus on the priorities. So This is what we have been receiving from our headquarters, that focus with your community and make sure everybody is safe and everybody is provided for.
Yes, Ambassador, I'm going to shift the conversation a little bit to the formal political level. So we are still seeing ongoing violations by the Israeli occupation authorities and the Israeli settlers, starting from the formation of an extreme government to the Israeli settler attacks on villagers and the exploitation of Palestinian workers who are working in settlements and in Israel. So what's your comment on that?
Of course. I mean, I'm not surprised, actually, starting with this agreement between all the major mainstream political parties, including Blue and White. They all met and agreed on one thing to form the government, which is the annexation of the occupied territories, the illegal annexation, which is a war crime, very well defined in international law. While the world was uniting to fight the coronavirus, Israel was uniting to commit war crimes. And of course, Israel is not comfortable, is not happy about the very effective performance of the Palestinian National Authority. I mean, Palestine has come out during this crisis as really a strong, effective state, as a government that is trusted by its people. And I tell you, Israel didn't like this. Israel doesn't want the world to see Palestine with such respect. Israel doesn't like the World Health Organization to come up with a public statement saying that Palestine has been one of the most successful, most effective institution in the region and worldwide, and one of the most advanced. So Israel would want to spoil the day, and spoiling the day is by what you mentioned, increasing their illegal settlement expansion while people are fighting such a lethal virus, allowing settlers to wreak havoc everywhere and attack Palestinian civilians, and not cooperating in every sense of the word. I mean, in the last few days, most of the cases that were recorded in Palestine were because of our workers in Israel coming back. Of course, those are our people, and they need to work, and it is legitimate that they work. But more cooperation with Israel could have saved us some of these infections that this situation has caused. So, unfortunately, this was an opportunity for Israel as an occupying power to actually take it and to realize that their wall that they have built deep in the West Bank, their checkpoints, their soldiers, their armies, their tanks and helicopters, none of this protect them from a virus. None of this protect them from such a pandemic. And we were thinking maybe this will create new hearts and minds. But unfortunately, military occupation and colonization corrupts. And I think there are so many hearts and minds that have been corrupted and unable to see humanity for what humanity it is, and unable to see the real threats that we are all facing, and very narrow in their thinking and twisted in their mindset that it's a zero-sum game. However, I think Palestine has been in this particular battle very effective, and I think the world has seen that Palestine, in the absence of full liberty and in the absence of a state and in the absence of sovereignty, Palestine has been performing like a very respected state. And no matter what Israel does, I think what is happening now on the ground would have taken us many steps in the direction of our freedom, our liberty, our independence, and fulfilling our historic, internationally guaranteed rights.
Thank you very much for joining us, Ambassador.
You're most welcome. Thank you for having me.
Thank you very much. This was Palestinian Ambassador to the UK, Dr. Husam Zomlot, joining us live from PNN studios, who told us there are currently tens of cases for Palestinians in the UK, many of whom are being hospitalized, including 2 recoveries. Again, the best way to protect yourself and the ones you love is simply by staying at home and taking all the precautionary measures that you can. This was Noor Qudaimat, live from PNN studios in Bethlehem. Thank you very much and good night.